Good evening, everyone. Welcome to the Tuesday, July 21st Board of Health meeting at 6:03 p.m. I don't see Mark DeSoni. Anybody on for citizens participation? Okay, if not, we will move along to the presentation of the Mary Mortensen Public Health Award. Welcome, everybody, for joining us. Chris, you going to take it from here?
Well, I have the proclamation in front of me.
Okay. Well,
so I'm ready to read it.
All right.
I've been practicing.
You're not waiting for anybody else, right, Kristen? Or
yeah, I think that Chris. Oh, there you are, Kristen. Hi.
Hi, I'm right above you.
Yeah.
My screen. So Betsy Emberly was supposed to be joining us. I just don't see her on my screen, so I don't know if she's there, but just hidden.
It doesn't look like she's there. I want to give her a couple minutes. Is there something else we can cut?
I was gonna say we can if she's not in the waiting room. No, we can give her a couple more minutes if you want.
Sure. It's up to you.
All right.
Hi, Kristen.
Hello.
How are you?
I'm good. How are you?
Good.
Good.
I don't want to move on to the next couple of items just because they're lengthy. Sierra's apartment. We don't see anybody from Sierra's. Mark, do you recall who's attending for Sierra's apartment? Is it Stephanie? Is that her name, Stephanie? Gotta love these Zoom meetings. You have to pay attention to who's with what group. Well, I was gonna say before we even move on, before we do that, I mean, Amy or Kirsten, do you have anything you want to say or anything not necessarily about the recognition you're getting, but any updates or anything you want to let us know about while we have a few minutes here?
Sure. I mean, I will just announce, and I think many of you probably have received emails that we have a new coordinator for decisions at every turn. Her name is Talia Seavey. She started back on July 6th, and we are thrilled to have her on board. I mean, we miss Samia, obviously. Samia moved on to another role in more of a public health oriented field. But Talia is actually an Ashland resident. She graduated from Ashland High School, and she just received her master's in health education. So we are very excited about what she can bring to the coalition and the community. So I can't wait to either introducing her via Zoom or in person, hopefully at some point.
That's great.
Yeah.
Good.
Thanks.
We see Betsy. Hi, Betsy.
There she is.
Hey, Betsy.
All right, Chris, you're up. Oh, sorry. Caught you in the middle.
That's okay.
Yep.
All right, I'll read the proclamation. Whereas the Ashland Board of Health, in honor of our longtime Board of Health member, Mary Penny Mortensen, has established an annual award in her name. And whereas the Ashland Board of Health will present the Mary Mortensen Public Health Award to a deserving community member or organization by nomination and a vote of the board. And whereas Ashland's Decisions at Every Turn is a volunteer coalition dedicated to promoting healthy decision-making through evidence-based education and prevention strategies to reduce and prevent youth alcohol and drug use. And whereas the current leaders and volunteers of Ashland's Decisions at Every Turn, Amy Turncliffe, Kristen French, Talia Seavey, Betsy Emberly, and Serena Lilly, as well as past leaders and volunteers, have dedicated their time, education, and passion to fulfill the mission of the coalition. And whereas the Ashland Decision at Every Turn coalition exemplifies how the act of volunteerism can make a difference in a community. And now, therefore, we, the Board of Health for the town of Ashland, do hereby recognize and honor the Ashland Decisions at Every Turn coalition as this year's recipient of the Mary Mortensen Public Health Award. We urge all residents to make known their appreciation for the Ashland's Decisions at Every Turn coalition's devotion to the town of Ashland. We offer gratitude and wish good health and good fortune to all leaders and volunteers of this important community organization. And it's signed Diane Mortensen as the chair on behalf of the Ashland Board of Health. Congratulations, guys.
Yeah, great job. You guys do awesome
Thank you
work.
very much.
Very, very nice.
Yeah.
I'm not as fluent with the meetings, but I do want to show that this is the plaque that hangs up on the wall outside of the Board of Health office. So we've had your name subscribed here. So this will be hanging on the wall. And with my other hat as Mary Mortensen being my mother-in-law, I just want to thank the board for continuing to do this recognition. it means a lot to myself as well as the family. Who choked up? Sorry. So I'm very happy, and I'm very happy that it goes to your organization for all your hard work and dedication. So thank you very much.
Thank you. I would love to. I prepared a statement if it's okay.
Absolutely.
I usually kind of do things off the cuff, but I wanted to make sure that I appropriately addressed everything that I wanted to say. But I mean, this obviously means it means so much to be coming from the Board of Health, because you guys have been supporters and backers of our work for decades, and it's really, really nice to have your recognition. But the formal piece is, first and foremost, we would like to thank the board for bestowing decisions at every turn with the Mary Mortensen Public Health Award. It is a privilege to be recognized for the very spirit for which this award was created, to have a positive impact on the Ashland community. We are very fortunate that our vision for all Ashland youth to thrive is shared by so many. Amy Turncliffe, Coalition Chair, and Betsy Emberley, former Community Programming and Social Norms Chair, both of who are here tonight, share in this vision, as do the dozens of Coalition stakeholders and partners who help to guide us. Lastly, it is important to thank all of the residents of Ashland. The real work, the efforts to make positive change, is taking place every day in our homes, workplaces, schools, houses of worship, and in the community. This % is only possible because of you. Thank you.
Very nice.
Very nice.
Amy or Betsy, do you want to say anything?
Oh, you know me. Always something to say.
That's okay. This is your forum.
I was telling Kristen, I texted Kristen earlier. I said, are you going to say something, or do you want me to say something? And she's like, I have something prepared. I was like, okay, well, I'll talk too if they ask. And I didn't prepare a formal statement because I knew Kristen was going to. But I certainly want to thank you all for this honor. And, I really appreciate all of the work that Mary did when she was part of the Board of Health. I think she made a lot of really important contributions to youth substance use prevention when she really was a leader and helped Ashland to become recognized for being proactive in tobacco regulation. So I'm just really honored to be recognized in this way and in her name. So now I get a little, so thank you for that. And as Kristen said, I certainly want to recognize those who came before us. So, the coalition's been in existence for a long time, almost 20 years, I think it is. So, this wouldn't be possible without all of those. And in particular, so actually last month marked my 10th year with the coalition. And in 2010, when I came on board, had like these 2 tiny kids. Now I have 3 larger children. Claudia Rose and Kathy Bach were just keeping the coalition alive. Parents in Ashland who really felt like this was important. And they had school administrators, and they just were kind of pulling anyone together that was willing to come to the table. And without them, I'm not certain, we'd all be sitting here tonight. So I wanted to recognize them. And let's see. And Liz Burns is the other one I'd really like to especially thank. So, Liz and Claudia really helped me to pull together that first federal grant that allowed us to bring staff, paid staff on board, like Kristen. Kristen's amazing. So thank you, Kristen. Allowed us to do that. And, that really does provide us with the opportunity to bring our prevention work to a higher level. Obviously, volunteers like Betsy are absolutely instrumental, and Serena, and we've got kind of a new crop of parents involved. And so I really want to thank them, in addition to, so many partners, collaborators, you all. I was going to say the town of Ashland has been amazing, especially in the second round of federal funding applications. So Ed has been, the police department. I really think that's what makes it so special, is that there's just so many different partnerships and collaborators throughout the community and beyond. So thank you all, really.
Good job, all of you.
Betsy, you all set? Or do you want to have a couple words? No.
Yes. You need to unmute yourself. I'm all set.
There you go.
Okay. All right.
Thank you for the honor
Yeah.
for all of us. It has been my pleasure to participate in the coalition and all of the collaborations. And I'm not really terrific at public speaking, so I'm going to keep it short and simple.
That's perfect.
Thank you.
That's not where my superpowers lie.
Well, like I said, we're going to hang the plaque back up at the town hall across the hall from the office. And thank you for everything you do. And we look forward to working with you again in the future.
Yeah.
Awesome.
Thank you so much.
Yeah, thank you.
And thank you for all you're doing. I know this job is now more than you ever dreamed it would be. So
Yeah.
Right.
Thank you.
all.
You're more than
right.
welcome to stay on the meeting.
Yeah.
I'm sure it'll be great, but we'll see later.
Yeah.
All right. Take care,
Good night,
everybody.
ladies. Thank you.
I
Bye.
think they're all
Bye,
going to
guys.
watch the grass grow instead.
Okay. Good night.
Thank you all.
Thank
Thank you.
you.
Thank you, guys.
Good way to start our meeting, right?
Yeah.
Yeah. I also would like to thank Diane and Ron for being on the committee for helping us connect with Decision Every Turn.
Yeah, they're a heck
They're a
of a
good group.
Yeah.
Yes, they are.
I think attending their meetings takes a whole new life as well. So.
Sure.
Okay, we do have a few minutes before Tim gets on the meeting. Jen, I know you just love coming to our Tuesday night meetings. You here for just no? Okay, we can move on. All right, so we're gonna wait for Tim. We'll wait for Cirrus. Let's see, Ed, do you want to do the COVID-19 update? You prepared to?
Sure. Hi, everyone. So a few updates for everybody. You probably got it earlier this afternoon. I did send out the updated numbers. If you notice, our probable cases are going up. That is people that are being tested for serum for antibodies. Depending on the result, with a lot of those, we have to actually send them for a PCR test. More and more of the labs and physicians are starting to realize if they send somebody for antibodies, that they also have to order that PCR test at the same time. So again, as more and more different types of tests come out, we learn different things. So again, but all these probables we have to trace just like we would do a confirmed case by PCR. So more on that later on. I do need to let you know about, I think I reported at the last meeting, we had a woman that had passed away in our community from COVID. And we had talked about the son was homeless and we had a dog and we kind of got the whole team involved. So I'm happy to report that we were able to assist him. We assisted him by getting the dog put up for adoption. We found Donna Walsh was able to find a home for the dog. We were able to assist him to get into a shelter. And then, of course, he didn't have a ride. So I picked him up on Monday and drove him to the shelter. And I was actually able to also get him some bus passes for the transit authority because he hopefully will have a job but needed some kind of transportation. So kind of full circle how this whole thing seems to work and everybody kind of pulls together to get things out. Also, the field use, as you all know, has been increasing. I have been doing random inspections of the fields when we have games with, for example, Ashland Youth Baseball and all these different teams. I have found a few issues along the way, but we are addressing them as we see them. Emails have gone out. I think I've CC'd the board on some of the emails that have gone out, reminding them of the proper procedures, what needs to be done. And that's pretty much the quick update on COVID.
Thank you.
Two thoughts here before. Hold on one second. KJ,
Sure.
just hold on one second. Just before we move on, it's probably two parts of the agenda, but I know that we talked about getting out to the food service establishments for the COVID inspections. I have not checked the database. I know you shared with us at the last meeting, but how are we doing on those? Are we getting there?
Yeah, Tom did a
Tom
few.
is on, yep, sorry, Tom.
Yep. I know Tom did a few last week. I know Mark was going out to do a couple of restaurants. I haven't seen the update. I didn't look at the updated spreadsheet.
So we're getting there.
Yep.
Okay, thank you. Anybody have any questions? Or Mark, did you want to follow up with Ed's COVID-19 update? Any board members?
Good evening,
go ahead, Mark.
everyone. How's everyone doing?
Good.
Hey, Mark.
We did get, since the governor put out notice that they can call local boards of health if there's any concerns or complaints. Within a day of that, we received a complaint of five facilities related to the appropriate use of facial coverings. Might it be for the employees when they wear a facial covering? It wasn't that they weren't. And also others that are coming into these businesses without facial covering. So I investigated those facilities. Tom was going to.
What kind of facilities were those? Were those food or?
Person mentioned 3 retailers.
Okay.
And 4 retailers actually. So in the other, a small restaurant. So, and we'll see more of those now that people are being more aware of the requirements, and we'll see more and more businesses starting to refuse their clients, or not clients, but their customers from coming in facilities. I think there's a major push out there to work with us to make sure people have facial coverings.
Any specifics on these facilities? Any names?
I can name them if you like.
I think so.
Well, I was going to say, I don't know that that's necessary, but what I was going to ask is, I know you guys had your training, so have you found the new program useful for that?
That was part 1. You're talking about now the Food Pro Code.
Well, I'm just saying, with the code, are you putting like those inspections that you did, you put them in the new system, right, under the COVID?
They don't go into the new system. The new system is for food inspections. These are complaints I'm going on for COVID-19. There's a distinction between the two.
Oh, no, I know. I'm very well aware of that, but I'm just that
I thought you were, yes.
No, but Ed's been using that program for some time for a trial basis for the COVID.
The program is meant for, if you look at it, it's for restaurants with open outdoor seating, reopening outdoor seating. That is for more of the restaurants. When it comes to retail, it wasn't set for that. But it is an interactive program, and we are planning, according to the person that created that program, she indicated to us when we did our Food Code Pro that program is meant for interaction between both the licensee, the food establishment, and our department. So we're going to try to get more people to understand, please, we're sending you a report, but also send us a report. It's supposed to be interactive.
Jen has her hand. Go ahead, Jen.
Mark, I know that these are just sort of new, that the governor has sort of pointed people to the Board of Health across the state. Can we set up, just because I want to make sure, sometimes Ed gets them directly, sometimes Laura's getting them, sometimes you may be getting them directly, just depending on relationships, or maybe, or Tom. So can we just have, if we don't already, and you may have already told me this, a Google sheet that's shared. So also we could also see if there's any trends. So if because I think these are relatively minor complaints, or they could be minor complaints, but if there's a repetitive a place, so we can just do stay on top of education. But I think if we have one shared Google sheet where we're sort of logging just the complaints and the place, and then action taken, and that way, I know Ed gets some things directly, and that way we don't have duplicating efforts.
Yeah,
and we get them
sorry,
go ahead, Mark.
That is in place. We talked about it the last meeting and 2 meetings ago. So, and when I do get complaints, I share them with Ed. So might it be an email and so forth. But we also have the Google Sheets to indicate what's been inspected.
So what Jen's talking about, I think, is something different, which I think is actually valuable for me and Susan answering the COVID hotline, is because if we get like today, I had a concern, it wasn't a food establishment. And it was something I was able to handle, but at least if I put it in that we had a call about this situation, we can see if it's a repetitive problem. So maybe we establish a separate one, or maybe attach it to that, however you want to do it. Just what the general concerns are, because then we can see, gee, every weekend it's a Saturday, it's a problem at this location, or whatever the case may be. Because then I can log the ones that come in for the COVID hotline as well.
I'll create that. I'll create that tomorrow, and then we can put a place where people will assign who's going to go out and look at it. I'll take care of that tomorrow morning.
Well, and also if there's a follow-up, because like I took care of this concern, but at least I can let you know that we had it and it was addressed. It's no follow-up, but I think we can establish that.
That's one place of record. That'll be good.
Yeah.
And within the Google Sheet that we're using and sharing right now, I categorized it because we're starting to do barbershops and beauty salons. So I highlighted it with a different colored line.
Okay.
That's been shared as well. So when we get complaints, we could do another section below the restaurants, the retailers, that would say complaints, that are not one of those two categories.
Yeah, I was going to say, if you and Ed want to work it, that would be great, because then at least we can log them.
Sure, it's been done.
Good.
Ed, you could just add another category on general complaints if you wish.
How does a board member get an access to those information? Or they?
You already have access to that sheet. KG, you already have access to that sheet.
Yeah.
Okay, good.
That's why I said I did not check it before the meeting, but
Neither I, but I'll go and check it out.
Okay. Ed, do you have anything else for COVID-19?
No, not unless anybody has any questions. It's busy.
I just wanted to add that, and I think Mark and Ed can speak to this, and I know Jen might be aware that the governor has opened up the Division of Labor Standards as another piece to be an active regulatory oversight for this. So they're always a resource, and if we need them to respond to a business who has an issue with lack of compliance.
Okay.
And let me add on to that. We already did contact them for one business, and they have been in contact with that particular business a few times now, and the state is handling it.
What was not to name the business? What was the violation or what they were doing incorrectly?
Not following any of the protocols.
So it was that wasn't a patron coming in or
no?
Oh, okay. Thank you.
I think there might be some merit. I can see maybe on a single violation, not naming the businesses, because it could be an anomaly and it could be just a mistake or something like that. But it might make sense that after, say, 3 violations, that they are publicly reported so that people know that these people are consistent violators, much like we would in a situation with a food establishment repeatedly violating situations. I mean, there should be some penalty. Something to think about.
That will also make the public more aware of it, so there may be an eye for us.
Yeah.
And I can say when we called DLS, Department of Labor Standards, when we did contact them about this business, they actually responded the same day. So I was quite surprised.
That's great.
That's great. All right, not that we don't want to keep talking about COVID, but we're going to move on to keep the agenda going.
Diane, I haven't finished raising one issue that I had.
Oh, I'm sorry. Go ahead, KJ.
There's an event coming along on the 15th of August. That's the raising the flag of India on 15th here to mark the 74th independence of India. So that there will be a gathering, and the group is working with Ed Berman, I guess. Is that Ed correct? And then has there been any issues with it, or is that clear?
Nothing yet. I sent him all the documents that he needed.
Okay. Thank you.
Okay, no problem. All right, everybody's all set. Well, I see Tim, you're on.
He's up.
Hey, how are you? Welcome. Oh, please.
He's muted himself, I guess, or you're muted him?
That's okay. I'm getting there.
All right.
Try this.
Did I just mute you? I think you unmuted yourself when I muted. There you go.
There we go.
I'll stop touching buttons. Hey, Tim, thanks for joining us.
Absolutely.
Mark, do you want to start off? Or did you want Tim to?
Hi, Tim. How are you doing?
Hey, Mark.
Very fortunate to have Timothy Deschamps here. He is the director of the Central Mass Mosquito Control Program, and they represent several communities, many communities now that we see them out there. And I'll let Tim give more or less the presentation of this season's mosquito-borne illness issues and what they do as a proactive approach. So with that said, I don't want to go any further than to allow Tim to maybe give a small presentation and then answer any questions the board may have.
Excellent. Thank you very much, Mark. As we all recall, last year we did see pretty significant EEE activity in the Metro West area, including the town of Ashland. So the Mosquito District started meeting actually in late November. We met several times over the winter to discuss trying to mitigate some of the initial risk from two species of mosquitoes that are implicated in either the transmission of EEE amongst the bird population or the transmission of EEE to the human population. So we came up with a plan, and we had 21 communities last year in our service area alone that were designated as either high or critical risk. So we spent about 2.5 months poring over maps, looking at topographic areas, using GIS, and then most importantly, going out and actually checking these sites, with field staff and personnel to determine if they're appropriate for a helicopter application, and if so, what the size and scope would be. So we did perform applications in all but one of those communities, totaling over 2,000 acres. In Ashland itself, we did perform 207 acres in the cattail mosquito habitat. These were areas, one large area was opposite Pond Plaza on the Sherborne-Framingham town line. There was another area that was in the Weston and Mulhall neighborhoods, pretty well impacted with beavers over the course of time, as well as on Main Street opposite Fenwall, another area that's been impacted by beavers. And finally, we designated some habitat off of Oregon Road near the Mass Pike. So those applications were done on June 1st. We used a 30-day product. It's a bacterial product that's certified organic. The product itself is called Natural R, and the active ingredient is a bacteria called spinosad. So it was a new product for us. We have been field trialing it for the past couple of years in these habitats. Again, we're looking for these cattail marshes. So these areas are difficult to treat for these mosquitoes because unlike other mosquito species, the cattail mosquito in larval form does not freely float in the water. They actually attach to the roots of the plants. So getting our bacterial products to the mosquito presents more difficulty than in an open water situation. So by using a 30-day product and a product that's also known to not only work with ingestion of the bacteria, but also strictly contact, we feel we did get some pretty good control. We have some traps in a few of our areas to determine how much control we did see, and we're hoping to also be able to see suppression of these mosquito species throughout the rest of the summer. In addition to that, of course, West Nile virus is another disease that we're concerned about. One of our main programs is treating for the Culex mosquito, a mosquito species that carries the West Nile virus. They tend to develop in a storm drain, so the catch basins in the city streets. So to date, we've applied our products in 1,510 catch basins in the town of Ashland. We have an active surveillance program ongoing with over a dozen locations that are being sampled. We send our samples in on a weekly basis. Thankfully, to date, we have not identified any mosquito virus in the town of Ashland. And we have received 265 service requests from area residents. So in a very brief nutshell, that's the work we've done for the past couple of months.
I always find it fascinating when you come to our meetings and you educate us on this, because it's very fluent to you, but it's always a lot of good knowledge for me. So I appreciate it.
Excellent.
Can I ask him one question?
Of course you can.
Do you get, we just got the email regarding the governor's enactment of that new regulation or law regarding the ability of the state to do whatever they need to do. Does that increase your resources to fight this, or is it just, does it mean anything to you?
That legislation initially was aimed at giving more authority to the State Reclamation and Mosquito Control Board. That's the board that oversees all operations of mosquito control in the state. Last year, in the Metro West area especially, they realized that a lot of the virus was occurring in communities that do not belong to an organized district. So that presented some legal issues as well as some logistical issues. So that legislation was filed by the governor. It's gone through a few changes as one would expect. What was added to that legislation was a task force will be formed starting in October of this year. They'll have 1 year to do investigations on bringing our operations into the 21st century. And they're supposed to be providing the governor a report in October of 2021. So it may not necessarily give us any additional resources, certainly not on the immediate basis, but we have been very fortunate to be to continue to be very well funded. We're very well supported by our member communities. We had the town of Grafton join our area last fall, and then just a few weeks ago, the town of Bolton also joined. So despite this COVID-19 pandemic, there have been a few communities that have been able to see some extra in their budgets to be able to, bring us into the fold as you would, as one would expect. So.
Good.
Or any of the members have questions for Tim? Now, do we have, I'll direct it towards Mark, but it might be, go back to Tim, but do we have a plan for the season for educating any public awareness? So what do we do from here between Tripoli and West Nile virus?
Tim, do you want to go or do you want me to start?
Oh, I can start. We certainly have educational materials that we continually restock in town hall, libraries, any place basically that's open right now. The challenge for us has been in our educational programs. Typically throughout the months of April, May, and early June, our entomologists and biologists are very busy in the school systems, educating school children about mosquito control and mosquito biology. Also, health fairs tend to be very common in the springtime as well. So unfortunately, the outreach on the per person basis, has dwindled to a trickle, if you will, or actually halted. However, we have been doing meetings like this, public outreach, and we do have a lot of printed materials as well. So if at any point any member of the board or citizen goes into the library, for example, and doesn't see any of our bookmarks, simple call or email over to the office so we can get them down there pretty quick.
Thank you, Tim. And also we link to your site, which is very educational. You have quite a bit of information on there, your
Good.
Site, that is. And we work with our media outlets. If we get notification of an issue within Ashland, we get notified through a health alert network, and then that starts to activate conversations with management, the board, Tim, and others, and we start getting the information out through the media, as well as our website is already active with linkage to your site.
Excellent. Thank
Well,
you.
I know we had a couple of meetings ago, we had a concern about the aerial spraying because we weren't, not directed at you, Tim, but towards Mark. I know that we're talking about doing different outreach for the residents of town because we had calls and we weren't, I don't think all of us were aware that they were going to do it. So is there any plan to do that again, Tim, or do we have another plan, Mark, to, do we have
aerial spraying would have to be mandated by the state, and I believe, Tim, correct me if I'm wrong, they would let us know 48 hours in advance. Jen did share with me some recent legislation that was passed by the state that Senator Karen Spilker sent to her. So it's set in place that there's limitations to what can be requested for no spraying. And Tim, if you can help me out on that, I know organic farms, honey bees, and so forth, but if that's what you're looking, are you looking for like aerial spraying in respect to airplanes or truck mounted?
Well, just in general, I know there was concerns that I think we got a call or maybe an email or something about, there was a concern about when it was done before. So I just wanted to see what we were going to do collectively for outreach to educate people. And obviously, hopefully people are going to be outside. So people, I think, are going to start asking a lot of questions. And I think it would be good to be proactive with, doing outreach.
I think not that we shouldn't do it, Dia. It's just going to be it's going to be a tough get with only potentially up to 48 hours. What if they decide on a Friday that they're going to do something, or Thursday that it's Saturday? I didn't realize it was that short of a window.
Well, I think if we have a plan, then we can implement it. Though, I mean, I don't know. Jen wants to say something, but I don't know how Tim does it in other communities. I don't know if they do a reverse 911 or what.
The advantage of advance notice for the public is they can shelter themselves or close the windows if they want to, so the people who are affected by this spray can save their health.
Right. Jen, were you going to ask something?
What I would say is, if aerial spraying for adult flying mosquitoes is even on the table, we're going to have indications long before the 48 hours begin, unless something extreme happens on a very quick basis. Last year, things did happen very quickly, but we still had nearly a week's time before decisions were nearly made and the actual applications did occur. So, certainly if an issue like what happened in Ashland last year occurred again, the board is going to be made aware long in advance that EEE what was a current situation, and then always in communication with me, I can get a sense from what the state is thinking on how they may progress with the response to that. A lot of it, of course, hinges on time of year, weather conditions, virus situations as well. But as of this point right now, thankfully, we do not have any plans for any aerial spraying, nor does the state. So while things can happen quickly, generally we can get a sense and get a little bit of the advance word out to residents to at least make preparations for it, whether it'll occur or not.
Last year it was quite different because everybody was looking for information because everybody was aware that there is EEE around. And this year, if they don't know that there things are happening, and then you sprayed without telling them, then they won't know about the spray situation. So that's why I think it's better to give them to give them advance notice. That's better.
Absolutely.
Go ahead, Jen. Sorry.
I was just going to make a suggestion that we can certainly have so last year we had some outlets in which we used to push information. Primarily, we used the website. We may want to remind people where that is, because obviously a year has passed and it's been quite a year. And so reminding people where they can get information, and we should push that to all the various outlets. So social media, and we can work with Beth and Ashley on that, and they can help us get the word out. And then also I was thinking, just based on Tim's presentation, which I really hadn't thought about, that primarily some of the public education and outreach is typically done in person, that perhaps it would behoove us to sort of move some of their educational materials online, and so that maybe we push, we work to push information. I don't know if it's weekly or every couple of weeks, just even if they just break it down to the small sort of social media, that we can help them get their word out. Because obviously, even if as we open up our library, town halls only open by appointment. I mean, we have very few people coming into the buildings to see the actual pamphlets. I do think that it's typically probably much more effective, but we haven't even opened up our library to people coming in, still curbside. So we are certainly missing that opportunity, and perhaps we will have to, maybe we can work
through the website for get notifications out
to get the right information and start to push it, maybe just in like those small tidbits, and that will keep it at front of mind for people. So we are pushing people outdoors because of COVID, and so remembering to put on insect repellent and all of those things. I think that's really important. So I think we got to couple these messages as we put them out, just to make sure that we're really thinking about overall public health.
Tim, do you have like does your organization, I know we had you in front of us before, but do you have like a PSA video or something that we could share on our website? Just, I don't know if you have anything like that we could.
We don't have one from us, but I know Mass Public Health does have a couple. So what I'll do is I'll find the links to those and I'll email them over.
Okay, that would be great. And maybe we could post those as well for the actual video. Awesome.
Jen was reading my mind, I think, because I just remember last year what a mess things got really quick, and part of it was completely out of our control, and we have to take blame for some part for not being as proactive or prepared as we needed to be, and we have to learn the lesson from last year. Now we have Ashley, which can be a great resource to be able to push information to the public in small bits. I think one of the things we have left over from last year as well too, when things got really bad and we put that mandate out that businesses couldn't serve food outside after sundown, I think we got to make that public now and empower Mark to put that into effect at whatever time he sees it necessary, and figure out a communication plan for getting that active should it need to be, so that if all of a sudden, 2 days from now, there's a swarm, something comes up out of our control and we have to enact that right away. People know it exists. People are familiar with what's going to happen, and Mark makes the call and it happens. So we need to think about some of those things.
No, I don't think that had a time limit on the action that we took. I think he can exercise the same empowerment now.
And that may be true. We should just revisit it now before it gets to the point where we have to.
Right. It had some color zone indications. I think severe, extreme, or whatever those things.
Yeah.
So those are the ones with.
Well, and I think that's where I was going at the beginning, and is maybe just if we have a plan that if. Let's say if Tim calls us or notifies us, this is where we're at. These are the 3 things we're going to do. Put it on the website, notify all the vendors, establishments, and then go to them. Okay. Or like if there's different scenarios, because I think, like you said, last year, everybody was a little taken back. And so I think that if we can just look at last year, and I know Mark, they had which I know there was compliments about, there was a meeting at the end of the season about, the do's, the don'ts, and what's good and bad. Maybe if we could just put together just type of, God forbid if I had to do it or KG had to do it or somebody had to do it and you're not here, we actually know what the protocol is.
Right.
Yeah, you mean.
I just want to make sure that
mosquito preparedness. Mosquito preparedness.
Right. Try to be a little bit more prepared, and if things go to the left and not to the right, at least we tried, so.
That's a good idea, rather than just trying to assemble things at the last minute.
Well, because I think last year hopefully was, an abnormal year, but if we can take those scenarios from last year and learn from them, I think that would be beneficial.
Sure, definitely.
For all of us.
Yeah.
That sounds good to everybody?
I have some resources too that I'll share tomorrow once they get back to the office. I'll get it over there pretty early.
Thank you, Tim.
Thank you very much. Does anybody have anything else for Tim? I'm sure he would.
Tim, one more question, just potentially as a little public service announcement. If people are looking for possibly commercially available safe products that they might want to use in their yard, is there anything like that available at big box stores, like the Lowe's and Home Depot, or even smaller hardware stores, or that doesn't exist?
No, it does. Everything that we use, all of our pesticides are consumer-based products. So there are some good products on the market. My recommendation, of course, is to read the label. Make sure that you're going after the targeted pest that the label says it's effective for. And then most importantly, follow their mix calculations, because we have seen it too many times where if a teaspoon a gallon is good, then 2 teaspoons is better. And that's absolutely not true. If the manufacturer wanted you to use more, they tell you to use more so they could sell more. But there are some good products on the market for both mosquitoes and ticks, some that are relatively short-lived in the environment, others that have extended periods of control, sometimes a week or 2, even a little bit longer. So depending on the formulation and application type, we always recommend read the label. And as a cautious note, most of these pesticides are going to be toxic to bees. So there's going to be what's called the bee warning on the label, telling you not to apply to flowering plants and when bees are actively out flying. Fortunately, there's some good products on the market. Most of the ones that we use, once these residues are dry, they're not toxic to the bees. So that's another benefit to some of these newer formulations of pesticides. So, but yes, in the big box stores, you can find some good products that you can use on your own yard as well.
Okay. Thank you.
That's a great question, Ron. And that's information like that. I think that's good stuff to get out there to the residents, because at least if somebody, wants to use the appropriate products on their property, All right, awesome. Anybody else have any questions? No?
Yep.
Tim, thank you once again for educating us. Absolutely. And taking some time and going over with us, and I'm sure we'll see you soon.
Sure thing. Take care, everybody.
All right, take care.
Bye-bye.
Bye-bye.
All right, I don't see anybody yet for Cirrus. So if you want, we'll move on. The annual nomination of Donna Walsh. You all have her nomination papers. So this is an annual appointment until April 1st of, I guess it must be, right, Mark? Must be March of 21.
Right.
It doesn't say. All right, can I hear a motion to nominate Donna Walsh as animal inspector for
Yes.
1 year?
Yeah, we assume that we have the powers, and then if so, I move that she be appointed as presented.
Second.
I'll second that. Okay.
All in favor?
Aye,
Chris.
KG.
Aye, Diane. All right, look at moving right along. All right, Mark, you're up for the IMA for the regional nursing services.
Thank you, Diane. The IMA for the regional nursing services is still under review by the group of the 4 communities. That's Framingham, Holliston, Hudson, and Ashland. There are questions that we have posed to them about how they fairly distribute services based on contributions of funding that each town is planning to place into the first year. So there are meetings coming up in the next 2 weeks that I will not be able to attend. So I have asked if, Diane, you'll see an email asking if you could attend. I know you had attended some of the preliminary meetings, but that's one of the key things that the board has asked to have resolved. And there's some other issues about, it just came through email that there's the concern about the person, whoever it may be, how many directors will she have? So they're trying to work that out, that the regional nurse will answer to one person or 2, and that would be in Framingham. There's still some, I would say, details that need to be worked out, but that's the key one I think the board was looking to see, is making sure the services are fairly distributed and what that means, as well as what additional programs. As Diane said, we're trying to get more for our money with regionalization. And sometimes that doesn't happen at the beginning, but it does come out in the long run. So are they offering promotional nursing services? And will there be that availability? And what do we do if we run into COVID-19 again and we need resources at that time? I can let the board know they have not hired anyone. And there was mixed communication with the health nurse, who's the director in Framingham, and myself a month ago. So they were hiring a nurse for themselves at that point. But that will be another part. They're having trouble, though. They're trying to seek help. And at this present time, they haven't been able to attract the person to that, the nurse to that position. So there's a few things that are still in motion, and I don't expect to see it completed, including having a regional nurse anytime within the next month. But hopefully they'll get moving along. And the question was posed to the region as well, is that we expect if we are spending money on nursing services in Ashland, that we will have to deduct that from our contribution until we have a regional nurse. So that's it. And if there's any questions, I'll try to help.
Well, I was going to say, of course, Laura, if you could just leave it on the agenda, we'll just have it on as a standing, spot on the agenda. Yeah. Not specific to the IMA, but Mark, could you just ask Framingham to just give us the city of Framingham, just to give us numbers of how many people that they're servicing now under the current system? Just, I assume they have it broken down by category, flu or tetanus or whatever the case may be, but just maybe some numbers just to see how we're doing now.
The other thing is, Mark, the person who they had interviewed and were supposed to have taken up the job didn't take it. Is that meant for that regional nursing, or was not that first?
KJ, there was some confusion there because I thought that's what they were doing, but now I understand that maybe they were looking for someone for their side of it. I'm not for sure. I think our best bet is to bring that up for discussion as well. And what will be the opportunity, because that is another question. What's the opportunity for our Board of Health to participate in the selection of the regional nurse?
That was not my interest. My interest is to find out whether there were significantly good number of applicants or not. Are there any interest in the nursing? Because there is a shortage of nurses, then there may not be that many applicants. So that's what I was trying to find out, if there are more applicants and they were able to select one or two from pool. So if you can get those numbers, that would help us to see how the market is.
You are correct, KG. There are not enough nurses, and they're not attracting anyone at this time to the position. We should be looking for someone that is multi-language, lingual. And they're also, again, there's not a large pool of nurses out there, so they may need to consider better benefits to attract into the field.
Yeah, but that
quite
only,
frankly,
only numbers can. Only numbers can tell. So get us some numbers from them.
Yeah,
well, and that's why I asked that honestly when we had that discussion, because I wanted to know why if they offered the job. I thought it was 3 people that they offered the job to. I mean, is it that the salary's not good? Is it?
The salary is terrible. Diane, at that salary, they're not going to hire a young nurse that can work in a hospital and make 6 figures.
Right.
You're going to maybe get a retired person who wants to contribute to the community.
Right. And I think we should, I think what we should do is, Mark, when he's talking to them, because clearly they know what this person is going to be doing. I mean, we can't, I think it should be reviewed. If the salary is that low that we've offered the job to 3 people and none of them took it, I think they need to go back to the drawing board, so to speak, for the salary.
And it may need to go back to the drawing board, but expect if it does, unfortunately, I think they're going to need to ask for additional funding from each community based on
the grant's supposed to cover a lot of that.
It was the initiation. No, that's what they can offer with the grant they have. The
grant is supposed to be an operable grant as well.
I believe it was initiation type work that the grant was.
The setup cost. There was a setup one, but there's also one to actually have a person on staff.
I'd be glad to ask that question, but to increase that salary, I'll find out if it is going to demand more resources from each town, which means.
And it has been some time that I haven't attended those meetings, Mark, but double check me, because I'm pretty sure that there was the startup grant that we had already gotten, and then MAPC was applying for a secondary grant for I'll call it the initial year, and it could be every year after that, because they might have to look at reallocating the budget for it. It might not be, I don't want them to, I think we should rely on them because they obviously are in this industry, but if you can get as many specific details on it, just so we know what's going on.
As Chris said, that if the salary is low, and if you need a nurse, you have to raise it, means you have to raise it. You have no question about it. There's nothing, because if you need a qualified nurse, you need to pay for it. You need to pay for it if you want the service. If you don't want to have the service, then it's easy to keep the money in the pocket.
Right.
And Diane, I'll be on vacation the next 2 weeks, but we can exchange notes if you do attend one of the meetings before you do, and help you out with what I know and so forth. But I appreciate your efforts in helping us.
I did see an email come through on my phone, but I'll look at it after the meeting and let you know.
Well,
Diane, if you have an issue in attending it, maybe Chris can also step up if he wants to.
Yeah.
And Diane, based upon that email that we got today about extra funds being appropriated for COVID-related things, that could be a little bit of money toward it. I mean, it wouldn't cover everything because you're only supposed to use it for COVID. But since nursing services cover that, there could be some money in there for that.
Right. Well, let's face it. I mean, that's one thing we need to find out from them as well, is because if we have, it's not on the agenda, but it will be. The Medical Reserve Corps is, still a hot topic for me, because we need to figure out if the city of Framingham is going to be involved with any clinics in the future. So we need, because like you said, that maybe there's allocation of money to help with the salary for that. So we need to know more specifics, and I know Mark is working on that, about what the position is going to actually do. So,
yeah, it does talk about recruitment of Medical Reserve Corps members, but I'm not for sure if it's specifically coming out, if the time allots for.
Well, no, but I think hopefully we'll be able to take care of that. I mean, just mean like for clinics, but so if they're going to be doing clinics for us, does that include COVID? So if it includes COVID, and is there any funding or is there any grants out there to help fund this position?
I believe it does not handle COVID, but I would ask Ed when he gets a chance. I don't know if he's here now. Yeah,
Well-
I sent a notice on that. It's for another meeting, but maybe some of the funding the town could get through CARES Act as well as what we get so far could be.
Can you double check before we get Ed involved with that? Because I don't want to mix duties, so to speak. Can you just check with the city of Framingham to find out if that would include, clinics? Would that include COVID?
Yeah. I don't believe it does, but I'll check.
Okay. And again, I know Stephanie and Tristan are on for Sirius, so we'll get to you in just a minute. But I think those are big things because in the future, if we have something come up, God forbid, but if we have something come up, are they going to help us through it? Or are we on our own? I mean, I think that's a big question because, again, I don't want to hope for anything, but what if something new comes up next year, and there's a clinic or whatever the case may be that needs to be followed. I just want to check. So.
Just for clarification, when I do send requests that you asked about hours, are you looking for how many hours they provided to Ashland over the past year? Or are you looking at how many hours they put into Framingham for nursing?
You asked me what I was asking for? It's not how many. Yeah, it's not how many hours. How many residents did they service, and what were the services?
Thank you, Diane.
Yeah, I just while we're talking about the IMA, I want to make sure.
Ashland residents, correct? How many Ashland residents?
Yeah, we just want to know our numbers, and they should be. And we should get a report every once in a while for that too.
No, thank you.
Yep. Yeah. All right, we're going to go back because Stephanie and Tristan, you're both here for Sarah's Apartments, correct?
You need to unmute yourself.
Yes, how are you?
Good evening. How are you doing?
Hi, Tristan.
Thank you. I'm going to let Stephanie take the lead on this.
All right, Stephanie. Stephanie, if you want to just go over your letter and just let us know what you're looking for. Actually, Mark, sorry, before you go, Mark, do you want to go over it with the board first?
Yes, just so the board knows, and it has been talking about nurses. Well, there's been a challenge to find lifeguards as well. And there's another apartment complex in town that's having the same problem. The issue was that training for lifeguards occurred right when the pandemic started occurring, so they couldn't get new lifeguards trained. And if an old lifeguard didn't have the training, it was difficult. Plus, the apartments, both Cyrus and the other apartment complex, utilize a service that brings in lifeguards from other countries. And so with the pandemic, that's limited that as well. And I've talked to that company, Continental Pools, and they have indicated it's very difficult to find lifeguards. With that said, Stephanie would like to open her pool, and she understands she also has to have a COVID-19 manager at the pool. So she's here to present her reason why she feels this year might be the year that she could request it from the board, and then it'll be up to the board after the question and answer period.
All right, Stephanie.
Hi, can you hear me?
We can, yep.
Okay, great. So we are interested to see if it's possible we can waive the lifeguard requirement just for the season for the apartment community. And we're reviewing the regulations and guidelines set forth and changes for the COVID-19, and we have limited our pool to just 10 people at a time to obviously reduce close contact with people and reduce transmission. Obviously, they're going to be wearing their masks if they're not in the pool, but due to the number of people our typical day could range between 20 to 30 people throughout the whole day over a course of a 10-hour period. We're only going to be limited to 10 people per time block. And in my letter, I set up an example of the pool schedule, what we're looking to do. So it's going to be basically a 2-hour time block that residents have to reserve in advance. They can do through our resident portal on our online system to reserve their time slots to use the pool. So it's going to be slots of 10 people at most. And then of the last half hour of the pool, of the 2-hour time block, the pool's going to be closed down so that the pool COVID-19 monitor can sanitize all the chairs, railings, any testing we need to do, and chemical balancing we have to do as well too in accordance with that. So for example, it's going to be open from 10 a.m. to 11:30 for use of pools for those who register in advance. Between 11:30 and 12:30, it's a longer break time because of lunch breaks. So we have them close down for an hour that time just to sanitize and do things they got to do to take care of the pool and take their lunch breaks. They're going to reopen for the next time slot at 12:30 to 2 o'clock. And that will, for people to use the pool and do their thing. From 2 to 2:30, it's going to be closed down, sanitizations of hard surfaces, door handles, and all that fun stuff by our COVID monitors. And then same thing again, closed for half an hour, reopen for an hour and a half. The last one's going to be, an hour and a half open, and the pool is closed at 6. Residents do have to be 18 years and older to use the pool, thus eliminating any younger people coming by themselves. Because it's so strictly monitored and have to be pre-registered, people can't be like, oh, I'm just coming in to do this, and my kids are still going to be here and leave. There's only 10 of you here. You're going to be in, you're going to stay in, use the restroom, and come back, and that's it. So younger people and the younger ones, minors, have to go with the adults at this point. Our monitors will check for IDs because they're going to have to recognize who our residents are because they're not familiar with everyone. A lot of people here, so they're going to verify names against the system. They have a printout to see if they actually are residents. We are not allowing residents to bring guests this year due to the limited number of spaces available, so our residents have a chance to use the pool and enjoy it when they still can. And we have adjusted the hours from what would be a 10-hour day to an 8-hour day, so 10 to 6 versus 10 to 8. So we believe with all these regulations and restrictions, we believe that a lifeguard for a 4-foot deep pool may not be the necessary thing this year because it is so restrictive. People are going to be limited in the pool, and we do have a person who's going to be there to call or we still have their phone outside to call for emergencies or people can get out of the pool and be safe and have all the space equipment around as well too.
So you'll have a staff person at the pool area. They're just not a certified lifeguard?
Correct. There'll be the pool, the COVID-19 monitor who'll be able to sanitize and make sure people are wearing social distancing and wearing their masks if they're not actively in the pool.
I have a question to Mark. Have you done that for any other properties around here?
We have for a semi-public pool. It's at a condominium unit, and it was based on ownership versus non-ownership. That is a small, depth-wise, it's about the same.
Which one is that?
That is the Lanterns.
Yeah, that was last year, and that was also pre-COVID.
Right, but that is not a deep pool at one side. It is all.
Yeah.
That is
correct. That was the main point with which we said yes for it, and then here I'm not sure what is the depth.
KG, if I can correct you, one of the other main points was that all of the residents were over 55.
Correct.
There were no children.
And they own the units, so technically,
they own the units,
technically it's their
so
right.
I need a couple of questions answered as well. Stephanie, can you tell me, or Tristan, can you tell me how many residents you have in Cirrus right now, and the dimensions of your pool, and what chemical protocol you're using to clean your pool? Are you using chlorine?
Yes, we are using chlorine. We still have continental pool that Mark mentioned to maintain our pool for us. We also do have a certified CPO, pool operator certified on staff as well too. So they'll be able to do the pool maintenance and chemical needs for the pool. In terms of number of people currently living at in our community right now, we have 366 occupants in our community right now.
Okay, and the dimensions of the pool, the length and width, approximately.
What's the
4 foot deep, and then I'm sorry, what was that?
What's the depth of the deep end?
4 feet.
4 feet all the way?
Yeah. So we have an inch shallow deck that's about 3 feet long, 4 feet long, and then stairs with a 1 to 4 foot deep section.
Part of my questions on the area, the dimensions, the length and width relate to my perception of being able to social distance in the water. But some of that, Mark, I'll ask you and anyone else that might know the answer. Does chlorine prevent or kill the virus? So that is the virus transmittable within a pool environment that's chlorinated?
That is still under discussion, but at this point, there's never been anything proven to say that the virus spreads within the water. That's still undetermined at this point.
And Chris, the state has also allowed swimming lessons to continue.
Okay.
The other question that I have for Ed, for a fitness center, you need to clean every time one person uses the equipment. Is that correct?
So the guideline states that the equipment will be cleaned frequently. It doesn't say after each use.
Okay.
But again, we met, like I said, we went and did education with all of the gyms. And we do require them to have a cleaning log that we can review.
So the same rule will apply here. So they don't have to clean after every person uses the lawn chair or whatever that they have.
Right. I mean, if
they were going to do that.
No, they're going to do it in between the break periods.
Right. So one group.
Right. But one group could stay there half an hour, but they're allowing it. The first block is 1.5 an hour. So the 3 separate groups can come subsequently to each other, so they can use it still from one to the other. They don't have to clean it in between, and then after that break they clean it. That's what I read it from the documentation.
So we're allowing during those, this is Tristan speaking, so during those blocks that they can reserve, we're only allowing one group into the pool. So during that 1.5 hour block, residents are not changing out. They sign up for that block. If they leave earlier, that's perfectly fine, but we're not allowing any other residents in to use those chairs or the area until the next block starts. So they're creating timed reservations for when they would be utilizing.
So you have between 10 and 11:30, and you say that they can use only half an hour block, right?
Nope. So between 10 and 11:30, at 10 o'clock, 10 people are allowed into that pool, and they're allowed to use the pool until 11:30.
Okay.
So they all get an 1.5 hour block with a half an hour in between to allow the pool monitor to sanitize the chairs, clean up the area.
And then they will use the same designated chair while they are there.
Yes.
Okay.
I have just a couple, Stephanie and maybe Mark and maybe Diane, you may know as well. Just from a legal standpoint, is there any liability? I know this may be a stupid question, Stephanie, but I'm going to ask it anyway, either to the Cirrus Apartments as far as from your insurance standpoint, or if we grant this waiver and God forbid something bad does happen, are we putting the town at risk for any liability if you have that 1 in a zillion accident that happens and there's not a lifeguard there?
Well, I'm going to ask, we can probably start with Mark, and then I'm sure Stephanie can answer her part of it. But
I'd be glad to help. And to answer your question, the state codes do not require a lifeguard. That's up to the Board of Health if they so wish to have a lifeguard. And we do have in town. Unfortunately, it's very deep, and I would suggest that one never gets a waiver until that depth changes. But the other note to make here is the fact they're going to need to post no lifeguard signs at the gate. They're also going to still need to follow all the other pool regulations. And that means having, as was mentioned, a person that's a certified pool operator available, as well as someone testing that pool, the chemicals. So all the pool requirements will still be in place, and the COVID-19 requirements. So with all that said, it is the board's choice. Liability-wise, I don't want to speak as a lawyer, but I know I can tell you within the regulations that we enforce for pools, it doesn't require. It only says if the board so with.
So the regulations that she asked for the variance does say, it says the operator shall provide 1 or more lifeguards 16 years or of age, or older, if the Board of Health determines that they are necessary for safe use of the swimming and wading pool. So did we adopt these, or is this automatic?
Those are automatic, Diane. Those are state regulations that apply to all cities and towns in Massachusetts. But thank you. That is the exact code that they're asking a waiver from.
Yeah, I do try to pay attention.
I would also say, Stephanie, if you're going to be interested, if you guys are going to be using a reservation system, part of where people are signing up, I would probably also include the same information that would be on such a sign, that there would not be a lifeguard present, that residents would be swimming at their own risk. I would make the disclaimer cover both for safety issues and for transmission of COVID or any other possible disease.
Just for clarification, if everybody, I'm just going to read the rest of it just so I can complete it, because it says,
okay.
The Board of Health, when determining whether there is a need for one or more lifeguards in the number of on-duty lifeguards to be present at the pool at one time, shall take into account the size, shape, capacity of the swimming pool or wading pool. As a guideline, it suggested that one lifeguard be provided for each 25 bathers. Lifeguard, and then it just goes into the certification. So, if they're only having 10, at least I feel more comfortable with reading that, knowing the guidelines that are put out by the state as well. And I think
I'm looking at the picture that was sent of the grounds with the pool, and I'm just going to take a crazy little guess at the dimensions. Those are probably 8-foot walls in the back, so it's probably 10 foot long. If I'm, 824, it's probably about 26 feet long and maybe 10 or 12 feet wide. So you're looking at roughly 300 square feet at 4 feet deep, just to kind of put some spatial issues into perspective when we're thinking about how many people. If only 10 people are going to be in 300 square feet, it's about 1 every 10 square feet.
All right. Does anybody else have any questions?
Mark, have you physically gone and checked out these pool?
Not yet, because they are not open. Once they decide to open, based on whatever happens tonight, then we do the inspection. It may be our on-call person that has to inspect if it's not open by Thursday.
Can you go before and then check out the dimensions to make sure everything is in kosher?
Well, I can do that by all means, but also I have to check other pool requirements no matter what. So I don't know, Stephanie, do you know offhand if they're getting the pool ready chemical-wise and clarity-wise?
The pool chemicals are ready. My last report, everything's in balance. The Continental was out here Friday. They've put everything together, even the last minute requirements for the first aid kit and stuff like that.
Please contact me no matter what before Thursday, because it's my last day for a couple of weeks. So we could have the on-call person, but it could take longer. And I just want to share with the board that Tom Curran, who's familiar with pools as well, has shared with us the information about the signage as it relates to the life.
And Mark, if most of the inspection is done and there's a small checklist, I'm sure one of us board members would be willing to come out also, as if it's
it's appreciated.
Convenient.
So Mark, not to put you on the spot, but are you recommending this? Are you good with it?
I'm not against it. I'll put it that way. I always would state that they should have someone there that's part of the apartment management, especially with COVID-19 now, but also someone that could, if they keep an eye on the pool and someone accidentally went in and they were, not paying attention, that's, usually the family will take care of their own, but in some respects, sometimes it might just be one person down here because it's a cloudy day and that person went in and unfortunately, say a medical issue happened. It'd be nice to make sure there's someone there with that other person. So
that's someone other than just that monitor that they have.
The monitor would be fine if they're capable of pulling someone out of the pool and making that quick phone call on the emergency phone that's required by the pool.
Right. But Mark, why do I see a hesitation here compared to the one for the seniors? You would not hesitant. You were just recommending it easily because the seniors are more difficult to handle than the youngsters one. Here I feel, or I hear some kind of a hesitation here. So is there any serious concern that we should be worried about it?
KG, you got to look back at the tapes. I'm hesitant on any pool. And I was hesitant.
But it was recommended. It was recommended by you.
Just in a general sense, because I understand where he's going with that. We just want to make sure that we have your blessing on it because you give us the guidance to make the appropriate decision. So
I bless things. I'm not here to bless anything, but I'm saying they have provided the board information that I feel is appropriate for a decision to be made. And if you were to ask me how I would vote only for this year. And I would be in favor of the vote, making sure that the COVID-19 monitor is on staff at all times when that pool is open with residents at the
okay, so putting words in your mouth, you recommend it with those following things.
Yes.
Okay.
So
do I
revisit it next year.
Yep.
Something. I'm sorry.
Sure. Okay. On the same regard, I just want to bring back the lanterns and the wood. Were they also not given a time-limited waiver?
2 years, I think. I think we gave them 2 years, if I remember
anyway,
correctly.
Check back and let us know, Mark, on the record, whatever it is.
The have there been any cases of COVID reported from that complex at this point that we know of?
I can't suppose that that's a hypocrite.
I was just going to say I don't think they can appropriately answer that question, but I don't know that would affect our decision.
Okay. Because I kind of if there have, it would affect it would alter my thoughts on it, and I would also kind of want to have the caveat that if there are COVID cases, if an active COVID case comes up, that I would probably want to look at the pool closing.
Okay, so Stephanie, hypothetically, if somebody that resides at your complex, obviously we all know that we're required to quarantine. We hope everybody follows the guidelines and suggest everybody follows it. Would you know?
We will only know if the resident should choose to speak with us about it.
Okay.
They're not forced to. Obviously, with HIPAA laws, they're not required to.
Yep.
We do always notify Mark when if there is a case, we'll always notify the Board of Health per our company policy and notify the rest of the people who live here. But if they don't tell us, we don't know.
Right. Question for Ed. On the fitness center, they monitor the temperature and things like that, do they?
No.
KG, what do you mean, the temperature of?
People's temperature.
No, they just have the questions that they ask them. A lot of them ask when they come in, and some are self-monitoring.
It's actually, that was one, I mean, my question is so, Stephanie, with this person who's monitoring the pool, do they ask them the series of questions when they make the appointment?
So it's going to be on the reservation system, but also upon check-in.
Okay.
We can also, if it makes people feel comfortable, we can have them sign, check off, no, yes, I've had a fever, all the health questions. Like I do have my kid's daycare right now. Every morning I have to fill out a form.
Well, I was going to say, I think if you go to the place, they make you do that, right?
And
Would that help you with that, Chris?
Yeah. Will the monitor do a self-check, or what do they do? Self-report?
The monitor, like for themselves?
Yeah, like employees do it on their own in the shopping.
For our company, our policy, we do make sure that the policy is if you're not feeling well of any sorts, and you are to not stay home and not come to work and go see a doctor, and then we can proceed as needed, but self-check and self-monitor at this point in time.
So do you anticipate the substitute monitors anytime coming up?
I mean, that could happen for any other reason, car breakdown, whatever the case may be. So yes, I do anticipate that, and yes, we are prepared for a backup.
You would have the substitute monitor well trained for the actions for the COVID and other details.
It's not just going to be one person. It's going to be 2 to 3 people to rotate through the schedule.
So you have a team, okay.
Yes, because a lot of hours in 1 week, 56 hours.
Yeah, that's true. A lot of hours.
Yes.
All right. Does anybody have any? Oh, I'm sorry. Does anybody else have any questions? If not, we can move forward with a motion.
I thought somebody was speaking. Who was that?
I had spoken over Stephanie.
Oh.
I apologized. So I think just to kind of pull it together here, I think the motion that we would have on the floor would be to, I think I can do this, make a motion Well, Mark, because there's no requirement, we're not actually waiving the requirement, just not, I guess it's, okay, it's 4.35.23, not requiring a lifeguard on duty during the operating hours, all COVID requirements adhered to, and all pool requirements adhered to. Is that the two?
And appropriate signage. I don't know if that has to be included.
And the signage, I believe, is part of the pool requirements, Mark, right?
Okay.
Yes, and what I would suggest is that the Board of Health has always required a lifeguard, so you're making an exception to that rule. And I would suggest that you take a vote, and a vote to allow them to not have a lifeguard this year with the conditions so noted.
Right, and it's section 4.35.23?
Yes.
Okay.
I can double check. I'm looking at another.
Oh, I have her letter right in front of me. Do I hear a motion? No.
Yep.
Sorry.
No, did you just make the motion, or one of us has to do it?
Well, I was just kind of summarizing it, but I mean, you can move that. Just, I think the only thing is it would be.
Yeah.
It's always the little ones that are barky. Yeah, and the only other condition would be is it would expire at the end of this.
At the end of the year.
Pool season.
Yeah. Right. So we can make a motion to allow Cirrus Apartments to be exempt from the requirement of having a lifeguard at their facility for this year only, with not restrict, with rules in place for appropriate COVID monitoring and signage saying that as far as COVID and safety at the pool, it's at your own risk, and the age limit of 18 as well.
I'll second that.
Not very eloquently said, but Laura can clean that up. She's a magician.
Seconded the motion. Is there any other discussion?
I would put an amendment that Mark do the inspection prior to implementing this for them.
Can we say
amend it to make sure that Mark gets the inspection done before
make it Board of Health member instead of Mark, in case Mark's on vacation.
Well, that's what I was going to say. Mark or a Board of Health member. Because Mark can probably do the initial, and if there's
it needs to be done before they get this waiver for them. Even though we pass it, that they cannot use it unless Mark clears it or one of us clear it with the inspection. So moved. Right.
We also have, just so the board knows on that motion, we also have Steve Ward, who will be on call if available. And I think if I could, Tom Curran can also follow the code and do that inspection as well. So hopefully they'll do it before Thursday. Thank you. I didn't mean to interrupt your motion.
No problem.
Okay. Thanks, Mark. So we have a second. All in favor?
Aye, KG.
Diane. All right, Stephanie, you were all set. Just give Mark a call and try to get as much done because Mark is going on vacation. So we'll try to.
Don't open it until the inspection from one of us or the Mark comes through.
Yep, Mark has to give. Yep, still has. They have a permit they have to get from Mark.
Before you guys leave, Stephanie and Tristan, I know that in your roles, it's probably very difficult because you have your residents coming at you saying, hey, look, we're paying rent and we want to use the facilities. So I want to make sure that you understand that we understand that challenge that you have in your role. And it's very difficult in this particular season because of the dangers. And sometimes they don't want to hear that you're doing things in their best interest because they just want to jump in the pool. So just know that we recognize the complexity of your position as well.
Thank you so much. Really appreciate that. Thank you for your time today.
And COVID inspections will be done by Ed or his team, right?
And I think it was also, I think, a well put together plan. So we appreciate it.
Yeah, actually, very, very well put together.
And we know you'd love to stay on the Board of Health meeting, so you're more than welcome.
That's kind of fun, to be honest with you. But thank you so much, for your time tonight. Mark, I'll be calling you tomorrow morning.
All right. Take care.
Thank you.
All right.
Okay.
Thank you.
Thank you, everyone.
All right, Mark. Moving along, we're gonna move to food program update. You muted, Mark. Oh, what else is Tom? I thought
That's my report. No, I just was saying I have Tom Curran waiting in line here too. Tom's been very helpful through the whole process with the new food program that we're looking at. Purchase the software. Well, we didn't have to purchase it because we had a grant for the year. Software as well as the hardware has been leased out to us on a grant. But with that also, and I've been dealing with, I don't know if Jen's with us, working with Jen on a plan. So the plan basically is to try our best to be more efficient. And this program is going to allow not just the efficiency, but it will also allow for the reports to be read by both the people that the food establishment operators as well as the general public. And it's going to include pictures. It's been a long, hard pandemic for our food establishments, but I think this will be a good tool to use. With that said, we also were in the middle of a pandemic when Tom and I were talking about additional help. We started looking at having someone come in. Might it be a contractor, or might it be a second person below in command, but Tom would be in charge of that person, to look at some of the low priority inspections, because it's very, very cumbersome to do high risk inspections. There's a lot to be seen. A grocery store can take more than 4 hours sometimes, and sometimes you try to coordinate that with district and the general manager. So the whole program is evolving as we speak, even though we're going through the pandemic. And one of the things I did want to mention is that we're hoping in the next few months we can attract someone to help Tom out, because
I was going to say, if I could just pop in there, because this is, I think, the first time I have heard a discussion about bringing on more help, but I want to make sure, and I'm looking at Tom, that I want to make sure that we are maximizing the amount of hours that you can do for us in our community before we even talk about bringing somebody else on. Because, I mean, that's just, I guess there's just a period after that. I want to make sure that if you are able to do more hours for us, especially right now, because we have to get these we want these COVID inspections done on the food service establishments. I mean, I am sure I could speak for the board, and we could probably take a vote on it, that we want to make sure that we maximize the amount of hours. So if you have more hours that you can give us, we welcome it.
I'm more than willing to commit to, right now as we speak, I'm obviously trying to catch up on my first round inspections because of the unique set of circumstances of how we started off with this pandemic in March. I think it was around St. Patrick's Day, but I've been trying to work very diligently in communicating with Mark and then the board if necessary, and getting out there to complete these inspections, and then working collaboratively with Mark and Ed, and then communicating with each other when COVID issues do arise. I think that checklist is definitely an effective tool that Ed has been utilizing. I make note of any issues on the food inspection form when they do arise, and then I notate if there's been corrective action on site, which there usually is. The good thing about this new inspection software is, and as Mark said, the final result, the final report that's generated is more user-friendly, and the operator can decipher what it says. Right now, the current software, sometimes it can be difficult to read the inspector notes and kind of decipher what exactly the violation is and what the corrective action would be. But as far as inspections go, like I said, I've been out trying to catch up, get all these, particularly the high risk establishments done first. concentrating on the supermarkets and then working my way out to the restaurants and then.
And do you find, Tom, I mean, kind of to the food program specifically, you know, the new software program, I should say, that you find that that's going to speed up your, I don't want to say speed up, but more effective in doing the reporting?
I think it's going to be more effective. I don't know, the speed initially, there might be a little bit of a lag time associated with it because it's data driven. So it's going to react to what's entered into it. And I know that we generated a master list that the company had loaded into the software, but I'm going to have to ad hoc some things in the field. I'm going to have to update certified managers. There was a feature in the software that I like that you could drag and drop in documents associated with the license. So I think down the road we might want to consider scanning the permitted establishments, the folders, the jackets that we keep at the office with the CFM certificates, the allergen certificates, the choke saver certificates, all that information I feel should be scanned into a PDF and then it should be emailed to me and Mark so we can just drag and drop it into.
Do we have the capability to do that now?
Right now, with the software that we're using, no, we don't. But with this,
I'm sorry, with the new software program.
With the new software, yes, we do. It has a document section, which I liked.
That's good.
And you can drag and drop in all pertinent documents, just so I can have access to information. Because I'll go into an establishment and 6 months later there might be a high turnover. There might be 3 managers later. I don't know if they have a serve safe. I don't know if the one that we have on file at the office is current.
Right. So you'll have everything in front of you versus having to worry about going to the office and pull the file and.
Exactly, yeah. And then as that information becomes available, it'll be easy enough just to drop it in the Xerox machine and scan it over, and I can just drag and drop it into the Food Code Pro software.
No, I know Mark. I know Mark had sent an email. So you guys have one more training under the new software.
Yes.
Okay.
Yeah, we're working out scheduling that as we speak to get more acclimated with that. There's also a feature on there that has like a test inspection, so you can kind of practice on a dummy inspection, if you will. And I still have to work on that as well.
Well, I had a question that to make sure that these inspections do have the start and the end times on it. Has that been fixed already?
I have to say that I've been looking at them and I know that the new program does have the start time and the end time.
Good.
I also, and if Mark wants to elaborate, but I know that the town is working on doing online applications and payments because, of course, I think it brings more to light because of COVID that people are doing things electronically so people can apply for permits. So I believe, and Mark, please correct me if I'm wrong, but I believe they can do the same thing. They can upload the documents to that and submit it that way as well. So I think it's another way for us to get the information without having a person-to-person contact. I know that you and Mark are working together and putting together a plan for the new program, the new software program, and the pros and cons and so forth for the grading. So we can talk about that at a future meeting. But I hope that the new program will make it easier for both of you to use, and at least you'll both be on the same system. I think that's going to be beneficial for both of you. And then I think, Tom, I think you had mentioned, because we spent a little time out in the field this season, I know that this system is going to function better for you. It's going to be quicker for you. I don't know. I think that's all you would need to do it out in the field, right?
Plus, I think it'd probably be able to provide all the data, and then we can do some statistical inference and sort of these things, and maybe
it'll all be in one
better.
Central location, right?
Correct.
Right.
Correct.
That's and the system is like any other. Like it performs at its optimum level based on it's data driven.
Right. Yep.
Have all that information.
We like data.
Yeah, exactly.
Oh,
especially KG.
But that helps.
Yeah, absolutely.
Mark, do you have anything else to add for the food program updates?
As noted, we really do want to make sure we have enough staffing We're overwhelmed right now with all the COVID-19. And Ed, I see you here. You're helping us, but even Ed's overwhelmed. So the staffing is going to be important. And Tom and I started talking about looking into the potential for additional help, especially if he's overwhelmed with COVID-19 and food inspections mixed in together. Ed, I know you're going to do the best.
I think we need to have this discussion when there's a full board. I think this is the first time I've heard that we need more help.
Well, it's a proposal. It's a plan. It's a plan. A draft.
No, I know, but we brought, and again, I don't want to get off sidetracked because you know me and my 8 o'clock time curfew, but we already brought on one full-time person from another department to help us. So saying that we're going to need more help.
Well, that's COVID-19. Tom and I were having a discussion on the food program prior to COVID-19.
No, I know, but you just brought up with COVID-19. We have a sergeant from our police department that we brought over to help oversee COVID-19. And now you're bringing up randomly that we need more food help.
I guess I would ask Ed then if he can do all the COVID-19 inspections. I don't think he can.
Ed, don't answer that question, please, because we can have an off-screen discussion.
Diane,
it's not appropriate.
Diane, why don't we just end that and put it on the next agenda? Yeah.
Yep, we will.
All
right.
I have an auxiliary question that assume that we are looking for an extra person. Do we have to buy another license for this food pro code if that is the case?
Let's add that. Let's make that
We're not
part of next
go
week.
Yeah, that's part of that discussion.
Let's move forward. Let's move forward on the agenda.
Thank you, Chris. Mark, do you have any more about the food program updates?
Just those are some of the plans. It's a draft plan. I want everyone to know that. I don't want to start any turmoil.
You have a plan?
I want it. Yeah, the one I sent to you, the draft plan.
Do we have it here?
Well, I sent it to you tonight because we've been working on it, Tom and I, and I thank Tom for his help on it.
Okay, but I don't want to talk about a plan that we don't have in front of us.
Next agenda, because you have an email, Diane, but I shared it with you and only you at this time because it just came out as a draft.
Okay, so
let's move on to the budget.
Thank you. Yes. All right.
Let's move on to the budget.
Okay.
Thank you, Chris.
All right, Tom. Thank you very much for joining us. We're going to move on to the budget.
Thanks, Tom.
Thanks, Tom.
All right. Before you go, Mark, before you go on to FY21, what I was curious about, I don't see it here, and it's not on the agenda because I know you mentioned at the last meeting there was an overage in the salary line item for FY. Oh, it might be right here. It's not. You had expressed that there's an overage. Yeah, there's an overage in the FY. This isn't right. In the FY20 budget, and you were going to let us know what that was. And I'm looking at it here. Is it the salary line item that's 10,000 over?
And I did ask payroll, and they forwarded me to Brittany. So we're trying to get the details. We may have to go back in time to find out what was happening with payroll. Did any of the COVID-19 payroll get mixed in with our payroll?
Okay.
So we need to check that. And Brittany was the lead person in Harold. So we'll try the data in the next meeting. I'm confused by it too because the budget was submitted with strict salaries, and I went over I thought payroll could tell me, but we'll research.
Okay, so what for the next agenda? If you could put FY20 and FY21 budget updates on the agenda instead of just 21. All right. So you want to go over the FY21?
It's a new budget, so we'll be working with that budget through the year, but it started July 1st, and you'll see. I don't know if additional issues will come up through the year, but
so if you look at what was expended. Last year, and you look what's budgeted this year, we're going to be over by even more this year.
Yeah, that's why I got to figure that out. I agree.
Okay, so yeah, because it's saying last year we expended 142,000, and this year it's only budgeted 130.
Yeah.
And the overall budget went down. The total line item budget went down. I'm going to round figure, say $800. So we went down $800, but our salary line item And I'm not saying that anybody doesn't deserve it. It's just doesn't look like it's properly budgeted. So
Yeah, I think Diana, having been in budget meetings at the state level for the past 3 months at my other job, we can sit here and talk about this 1,000 times over until we know the actual reason that caused that budget overage. We can't make a real
no, that's why I want to make sure, Mark,
about it. So yeah,
right, because this starting out this year, we're already in the hole.
Right. You make a great point.
Yeah.
You make a great point, but I think that we should probably just leave it at that and make sure that we have the research we need to make to have the discussion at the next meeting.
Sounds good. Let's look at that. Anything else, Mark, for the FY21 budget?
No, I agree again with Chris there that we really do need to get all the figures in place, and I need to grab as much information as I can, obtain it through our financial coordinators.
Okay. So you can get that update for the next meeting?
Yeah, I'll ask for it, and then we'll try to chase down what happened with the last agenda the last budget FY20, and make sure FY21 is properly submitted.
All right. Did everybody get a chance? This is on to the minutes. Did everybody get a chance to look at the June 2nd and June 23rd?
Yeah,
I did,
Yep,
and I moved that they are both moved forward as amended.
I second that.
Okay, I'm nothing major and nothing to even report on right now, but I just have a minor correction for Laura, just something I said, so I'm going to have her just update it, but it's not substantive, so it's not a problem.
Yeah, she did send the updated one anyway.
It was like
I'll sit down and talk. Yeah, nothing major.
Okay.
All right, so we heard a second. All in favor?
Aye, KG.
Aye, Chris.
Aye, Diane. All righty. All right, so for future topics, I know that I mentioned already the MRC. We have the FY20. We're going to add the FY20 back to the FY21 budget. And let me just, I believe.
I think you wanted to do the potential protocol for, informing about mosquito spraying and updating people.
Yeah.
Something like that.
Triple E and West Nile virus.
Yeah.
Outreach.
Yeah, well, however we want to make sure that we inform people if there's issues with it, whether it's
I'd like to come out of our next meeting with an actual plan.
Okay.
Yeah.
So for the next meeting, we want a Triple E and West Nile virus outreach plan from Mark.
So Mark would assemble all the document that's needed for public announcements if there is a case that warrants it.
I'll work with our media people. Ash is the new person for social media.
Yeah, so if you can put together a plan that we can review, and just so we're all on the same page at the meeting.
And if you want to put a script together, I can do some of the reverse 911 calls.
Yeah, and those are things that, like you said, if we have like a draft script of what we're doing, just so at least we'll be prepared.
Yeah. Diane, if I could, when's our next meeting?
Well, I know it hasn't been discussed, but I know you're on vacation and Laura's not going to be here on the 4th. I mean, I'd be, we could have a meeting as a board if the board so chooses.
That's fine.
I mean, we can have a meeting, or if you want to, Mark, you're not available on the 4th. Is that correct?
That is correct. And I'm not available on the 11th either, but I can.
Okay, so we'll meet on the 4th then as a board.
Sure.
And then Laura, what I'll do is I'll record the meeting for you.
Okay. Yep.
And then so we'll put the agenda items that we just discussed, we'll put them on the agenda, and then we'll get the information. Mark, you're not going to be able to get this information to us then before the.
Can't. Yeah, I'll try my best.
Mark, if I can do anything to help you, whether it's just talking to you and reporting it to the board so you don't have to do that, or any way I can help, I'm happy to do it.
I appreciate that, Ron. Thank you.
Okay.
So we could mark that week. I mean, we could move that to the 18th are you available on the 18th for the board meeting?
Yes, I am. It's only the first.
So how is, if the board's okay with it, we can put it on the agenda for general discussion, but the actual plan for Mark will do the 18th. Is that acceptable?
Sure.
It's fine, but what happens if there is
I
a...
Mark to rush it and not, I want him to put,
Correct.
So we'll plan that for the 18th, but again, we'll keep the same discussions on so we can review them. And, it might be, a quick meeting, so. All right, so we'll meet the 4th and the 18th. And then Ed, we'll, if you want, if you have updates on the COVID, we'll still have you on for COVID updates.
In the meantime, if there is a change in the mosquito population or something, who is going to keep us alerted, Mark, in your absence?
Yeah, as I typically do on vacation, I'll keep an eye out for any notifications.
Does Laura get the emails as well? Because she can send them to us.
Yep.
But she's also be off, right?
I'm only off for a few days. 3 days.
Oh, okay, then it's fine.
All right.
Well, we get those reports every week anyway.
Mm-hmm.
Yeah.
Right.
Anybody have anything else for topics of discussion for the next meeting?
We'll definitely have the food proco email item, right? An update on it.
Yeah, those will keep us busy.
I guess so.
I think Chris's point about or unless KG figured that out, about the restaurants and potentially if there is mosquito issues about having the authority to unfortunately tell these owners that they can't have anybody sit outside. Not that I really want to do that, but
right.
Does that fall under the mosquito protocol thing, or is that a separate issue?
We should at least go back and look at what we did last year, whether we kept it open-ended or not.
I think we kept it open-ended, subject to whatever that the color indicators were.
Yeah.
Well, we could ask Laura. Maybe Laura, if you could look into that and see if you can find the discussion.
Yeah, let's
You don't even need to have it on video, even if you just have the discussion. Just so we can have that. Because then it will at least give Mark even a baseline too.
Mm-hmm. There was a proposal and a vote, so that proposal will tell you what it was anyway, the wording.
Right.
So that's
right. Okay. All right. If nobody, Ed, did you have anything else? I know you just hung on tonight for this meeting.
Because he's the best.
He is the best.
I just want to make sure from the board the data I'm supplying, is that the way you want it? The numbers? Is that fine, like with the probables and the confirmed and all by age and everything?
Yeah, definitely.
Okay.
You've been doing a good
Like
job.
data, once again, it's that data, right?
Love data. And Ashley, the website is updated also.
She's right on top of things as soon as you post things. Yeah.
Yep.
Great team. Great teamwork.
Yep. Thank you.
Yeah.
All right, everybody. If nobody has anything else, I'll entertain a motion to adjourn.
So moved.
So moved. Oh, sorry, Chris.
Second.
Thanks, Mark. Thanks for the notes, Laura.
Okay.
All in favor?
Hi, KG.
Chris.
Bye. Have a nice vacation, Laura. Take
Thank
Enjoy
you.
a couple
everybody.
days.
Bye.
Yeah, enjoy.
Thank you.
All right. Bye, KG.
Chris, bye. Chris, you keep changing your background scenery all the time.
Yeah.
All right, everyone. Have a good night.
KG, hey KG, are you going to be there tomorrow for the schools?
For the school, yeah, I am.
Yeah, okay, I'll be there. So I'll see you tomorrow.
Sure.
Yeah, who's up? Ron, are you going? Well, Ron, are you going to that? You're not going, right, Ron?
No, we have some guys out, so I'm
problem.
jamming. But I figured there'd be enough people anyway.
And I don't know, Judy wasn't
Do you want
feeling
that
good.
on the agenda?
Yeah, that should be on the agenda right next
that's
time.
right.
Yep, there you go. Thanks, Laura.
Yeah, reviewing that.
Yeah, I don't think Chris was going to go anyhow, but KG, it might be just you and I because Judy, like I said, wasn't feeling good. So
Yeah, and I'll be there.
with
All right.
bells on.
I'll come with my mask.
I'm driving the bus.
Ed, what the hell else can
Driving
you
the
do?
bus?
Are you going to start, are
Huh?
you
Driving
going
the
to start
bus, Ed?
plowing and doing, others? What else can you
Well-
do for the town? You're unbelievable. It's
Well-
really.
All in all.
Listen, I thought you were going to hire me for your office.
Ed, Ed, they all in all.
Dude, we cannot afford you. There is no way we can afford all the stuff you do.
The problem is that he will not have
Neither can we. That's why he's paid to the police department.
with you know,
Exactly.
with so much working around, he will not have time to count the money.
Don't worry, his wife's got that covered.
I just got my son's tuition bill.
Oh my gosh. Yeah.
Pass it along to the town.
Yeah.
All right, everybody.
I'll see you guys tomorrow.
We'll
Bye-bye.
see you
All
the
right,
4th.
take care.
Bye,
Have a
guys.
good night.
Bye-bye.
Bye, KG.
Bye-bye, Ron.